We know that migraine preferentially affects women, particularly in our childbearing years. In fact, 1 out of 5 women chooses to avoid pregnancy because of her migraine diagnosis. Because of this, and the fact that we don't have great treatment options to help women when they're pregnant and have migraine, recently my colleagues and I decided to do a study looking at the safety of triptans, which are considered a first-line treatment option for migraine, and their safety in pregnancy. My name's Rashmi Halker Singh. I'm a professor of neurology at Mayo Clinic's Arizona campus, and I work in the Division of Headache Medicine. The title of our article is Safety of Triptans in Treating Migraines in Pregnant Women, a Target Trial Emulation. This will be appearing in the November issue of Mayo Clinic Proceedings. We did this study by looking at our electronic health record. We apply the same rigorous criteria that we would use for a randomized clinical trial to reduce the risk of biases. What we found is this. We did not find any added risk in pregnancy outcomes when women were using triptans. This is an important finding. Basically, we can think about triptans for our patients who are pregnant. I think this adds to the medical literature on this topic. There is a growing body of evidence supporting the use of triptans when women are pregnant. At the moment, they're considered a second-line option, and I think this data set adds to that conversation. For my clinician colleagues, when we have women with migraine, let's start the conversation early about what they want in terms of pregnancy. Sometimes our patients don't bring up the conversation or even have the conversation with us about whether they want to become pregnant or not. So it's a good idea for us to initiate that conversation and let them know that we have suggestions for how we can help mitigate that and manage migraine during pregnancy. When we have a woman who is pregnant, I would suggest thinking about triptans as a second-line option. The next step for our work is to really investigate other options to help women who have migraine and are contemplating pregnancy as well, because while triptans are one option, there's many more things that we hope to be able to offer them as well. I invite you all to read the article as we work to improve migraine management for all of our patients.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.